Cataract is one of the commonest eye problem we come across in any person or in any community. Cataract almost and always is the only long case kept in the examination for undergraduates in ophthalmology. Welcome back to Ophthalmology for undergraduates and postgraduate beginners. Today's topic is examination of the lens. Before going to learn about what are the things to be examined in the lens, let us learn some basics. A lens is a biconvex structure made up of three parts: the outer capsule, inner nucleus and the middle cortex. Lens appears to be black in color when you examine the eyes. Where do you examine for the lens? Within the pupillary area. Actually, lens is a transparent structure. It appears black because of the underlying retinal pigment epithelium. Next is, the lens is positioned in a fossa on the anterior surface of the vitreous. This fossa is called as patellar fossa. Lens is one of the most dynamic structure that is present inside the eye. Why I am saying lens is a dynamic structure is, you can see farthest things clearly and you can also see the nearest things clearly. When you look at the farthest distance, the lens becomes slender, very thin. When you look at near objects, the lens becomes thicker. So it can change its shape. While examining the lens, we have to consider 5 things. The first thing is the color of the lens. Second is the shape of the lens. Third is the position of the lens. Fourth is the abnormal mobility of the lens. We will start with the color of the lens. The lens appears to be black in color because of the underlying retinal pigment epithelium. That is what we told. A normal lens appears to be black in color in the pupillary area. If the black color in the pupillary area appears to have a glistening or a shining reflex when you throw light on the eyes, then that is an artificial lens or a IOL kept in the lens following a cataract surgery, that is called as pseudophakia. If the pupillary area appears to be jet black in color, what do you mean by jet black color? Many of you might have experienced seeing a newly painted blackboard in the schools. So that will be like a coal. So if the pupillary area of such blackness without any shining or glistening reflex, then there is absence of lens in the eye. That is called as aphakia. Aphakia is nothing but absence of lens in the patellar fossa. It can be present anywhere inside the eye or it may not be present in the eye at all. But it is not present in the patellar fossa. Next is, the lens may be of different shades of colors. It may be grey, greyish white, or it may be pearly white or milky white. These are different stages of a cortical cataract. A grey color lens you will see in incipient cataract. Greyish white color lens you will see in immature cataract. Pearly white lens you will see in mature cataract. Milky white lens with sunset appearance, the nucleus sinks to the bottom. So that you can see in hypermature cataract. If the lens appears to be green in color or yellow in color, amber in color, or brown in color or black in color, or it may be red in color, this is a diagnosis of nuclear cataract. Nuclear cataract has 5 grades: grade 1, grade 2, grade 3, grade 4, grade 5. Next is appearance of blue dots in the lens. This is classical of congenital blue dot cataract, occurs in children. It is there for the lifetime. Next is a snowflake cataract, that is classical of diabetic complicated cataract. Diabetes leads to a snowflake cataract. Sometimes the color of the lens may resemble a sunflower. This is classical of copper metabolism disease, that is Wilson's disease. Sometimes the lens may appear like a breadcrumb. It is due to long-standing inflammation inside the eye. That is, long-standing iridocyclitis can lead to a breadcrumb cataract. A rosette cataract appears like a rose petals. This is classical of blunt injuries of the eye. Normally, the lens is biconvex in shape. Let us see some examples for abnormal shaped lenses. Coloboma of the lens. One portion of the lens is not developed. There is a defect in the lens development. This is a congenital problem where the zonules on the inferior aspect are absent, so that the lens does not develop on the inferior aspect. Next is the posterior lenticonus. The posterior convexity becomes conical in shape. Anterior lenticonus, anterior convexity becomes conical in shape. This is an example for Alport syndrome. Sometimes the lens, instead of being biconvex, it may become spherical. Spirophakia. What are the conditions you will see? Spirophakia, Marfan syndrome, Weil-Marchesani syndrome, hyperlysinemia, familial microspirophakia. Coming to the examination of the position of the lens. Already we have told where the lens is located. We are only seeing a portion of the lens through the pupil. Sometimes while examining the eye, you can see the margin of the lens in the pupillary area. One part of the pupil will be having the lens, the remaining portion will not be having the lens. That is called as subluxation of the lens. The lens has partially moved from its position. Sometimes the lens may not be present in the pupillary area at all. It has completely moved away. Then that is called as dislocation of the lens. Next, we are going to talk about ectopia lentis. There are certain syndromes that can be presenting with ectopia lentis, abnormal position of the lens. The first example is a Marfan syndrome. Here you can see the lens is dislocated upwards and towards the nose, towards the nasal portion, upwards and nasal. This is Marfan syndrome. It will be present in both the eyes. You will be seeing the margin of the lens in the pupillary area. This is another case of homocystinuria. In homocystinuria, the lens is displaced down and outwards. In both the eyes, you can see the margin of the lens in the pupillary area. These are some of the examples for abnormal position of the lens. Fourth important thing in the examination of the lens is the iris shadow. What is a shadow? First of all, suppose I am standing like this. There is a light on this side. There is a road or floor on this side. What will happen? My shadow will fall on the floor or road on this side. Suppose I am lying on the floor or road, what will happen? Because I am directly lying on the road and there is no space between me and the road, shadow will be very minimal or you cannot appreciate a shadow at all. So, for a shadow to be appreciated, there should be some clear space between the object and the surface on which you are going to see the shadow. The same thing we have to apply in the iris shadow. In immature cataract, all the lens fibers are not opacified. There will be some lens fibers which are not opacified. If you have some clear lens fibers between the cataractous portion of the lens and the iris, and you throw light from the temporal side, you can see a crescentic shadow falling on the same side of the illumination in the pupillary area. This is called as iris shadow. This is because of some amount of clear lens fibers between the cataractous lens and the iris. In case of mature cataract, where the full lens is opacified, there is no clear lens fibers at all. There is no clear lens fibers between the iris and the cataractous lens. So if you put light, you cannot appreciate this shadow. No shadow means mature cataract. If you see an iris shadow, then it is an immature cataract. Final thing, when you examine the lens, you should look for abnormal movements. As all of you know, the lens is held in its position by the zonules. These zonules attach the lens to the ciliary body. The zonules will be present all 360 degrees. If the zonules are intact, the lens will not go in for abnormal movements. Sometimes, if some part of the zonules are broken or they are very weak, what will happen? When a person is asked to move his eyes to and fro, the lens has lost its full support. So what will happen is the lens will have fibrillating movements like this. This is called as tremulousness of the lens. This is called as phacodonosis. The support of the zonules is not fully present. When the lens is fluttering like this with the movement of the eyes, naturally the iris which is on the lens, resting on the lens, will also flutter with the movement of the eyes. That is called as tremulousness of the iris. The other name for it is iridodonosis. Phacodonosis and iridodonosis are tremulousness of lens and iris in the zonular weakness that has happened inside the eye. Iridodonosis is also observed whenever there is absence of lens in the patellar fossa, that is in aphakia. Because there is no support by the lens to the iris will have fibrillating movement when the eyes are moved. That is also called as iridodonosis. I hope I have covered the important things in the examination of the lens for an undergraduate student and also the postgraduate beginners. I will stop here. Let us see about extraocular movements in the next video.